So a lot of folks are talking about this case in Kentucky that happened where a nurse in ICU, who was a charge nurse with 3 patients, gave a dialysis solution instead of Go Lightly as a bowel prep for a patient who was 81, male, who was supposed to be getting a endoscopy. And one of the things I want to ask people to do is really think critically and discuss this critically, because this has to do with staffing. This has to do with staffing. It has to do with pharmacy staffing. It has to do with, when you're charge nurse, why you should not have patients and be forced to take patients. And if this nurse in ICU, with a normal case patient load for a regular nurse would be 1 to 2, not 3, that tells me that probably the other nurses also had 3 patients. And this nurse also has to give breaks, right, to everybody else. Have no idea how that happened. In some hospitals, the ICU charge also has to respond to the codes. So again, they have to leave the floor often with patients. So this is a complete setup for disaster for any kind of, error to happen or oversight. It's horrible. It's unfortunate. I want to also point out that the drug, it's not actually a drug, by the way. So the solution that was given is actually licensed under the FDA as a medical device because it's proprietary to Fresenius, the dialysis company. Now, should it have been left in the room? Absolutely not. Should have been marked properly. The labeling on these bottles, I guarantee you, is going to change, because it really needs to have some much stronger labeling saying, it's poison, not for oral ingestion, something so it can't be confused. But again, this speaks to how did the pharmacy account for them delivering that? They didn't. They just sent a label, because obviously they didn't deliver the Go Lightly. Or where was it? Or was it not properly labeled? So again, yes, it could have been avoided, but you've got to put it in the context of a charge nurse having 3 patients in ICU. Complete setup for disaster. This is why we need national patient to nurse ratios, everyone. So again, this is why it's not safe to be in a hospital, and why you should be asking how many patients your nurse has. And if your nurse is a charge nurse, you should refuse. You should say, you should go right up the chain of command, call the nursing administration, call the VP, and say, you know what? Your charge nurse should not have patients. This is dangerous. So this is really on the hospital, and it's also, shared with pharmacy. And this is also a solution that's not given at one time. Nobody drinks all this at one time. It's almost a gallon. It usually does go over 2 different shifts. So the second shift won't know or be able to verify what's in there more often if it's already